I mean, the most obvious one, of course, is that he can't have sex, which is a damn.
Well, hello, my name's Hal. I'm a retired airline pilot. I worked for Qantas International for almost 40 years, retired at 60. Fortunately met the lovely Susan, and instead of living in Australia, I'm now living in New Zealand. I learned about my prostate cancer in 2010 quite by accident. At the time I was diagnosed, my PSA was just 2.9.
Well, obviously I was really shocked because we were due to get married.
Susan at the time was living in New Zealand, I was living in Australia. Privacy laws meant that she might not be able to receive information on my disease or the treatment, so we decided to get married, and that removed the privacy aspect of things. The rest of my family took it all very well, and were very helpful and comforting, I suppose is the word, although there was nothing to comfort me for because I was totally asymptomatic.
Certainly the first lot of treatment, it has affected his physical strength.
It had one aspect which I didn't like. It made my breasts very sensitive, and eventually I grew a very nice set of boobies. Apart from that, no real side effects from the bicalutamide. That really kicked in when I moved on to Zoladex. The Zoladex implant took away most of my body hair, took away a lot of my muscular strength, and also prevented me from having an erection, and that was quite a blow for both of us, being newly married.
Basically our thoughts were, it's just not fair, you know, to find such a wonderful relationship and then to have, to some extent, the ground cut from underneath you, but you get on with it. You either have them or you don't, and I know which I'd prefer. So we've managed to have, apart from that, a pretty normal life.
To both my wife and myself at the time, it sounded just like the thing we needed, because from a point of view of lifestyle, it was once every 6 weeks instead of every fortnight.
That really suits us, our lifestyle, fine. It doesn't interrupt it.
It was a fantastic option. It was the right choice.
I think the best way of supporting somebody with prostate cancer is to talk about it, to get them to talk about it, talk about their fears, and to just reassure them that, hey, let's just live with it, work with it, get what treatment we can, and yeah, just keep on going. Enjoy them, you know, what you do, what life you do have, and your friends, your family, and don't let it get in the way.